Did you ever had experience with cough? So almost everyone of us had cough some or the other time in our life. So it is mostly for us it is associated with the cold. Okay, that is normal cough means which is temporary cough, right? So what are the other reasons of cough? So there may be pharyngeal origin. So common cause of this are post-nasal drip. So clinical features will be patient presenting with the history of chronic rhinitis. Okay. Uh, then laryngeal origin. Common cause are laryngitis, tumor, whooping cough, and croup. Okay. Then clinical features will be voice or swallowing altered, harsh or painful cough, paroxysms of cough often associated with the stridor. Trachea, common cause is tracheitis, which is inflammation of trachea, raw retrosternal pain with cough. Bronchi, common cause are bronchitis and chronic obstructive pulmonary disease. There may be dry or productive worse in the cough is worse in the mornings. In asthma, we will see dry cough, which is worse at night. Eosinophilic bronchitis, it is also dry cough, which is worse at night, but airway hyperreactivity is absent. In lung cancer, there is persistent cough, which is often associated with the hemoptysis. Lung parenchyma, common cause where the lung parenchyma is involved in the origin of the cough is TB. You will see productive cough often with the hemoptysis. Pneumonia, you will see dry cough initially, it becomes productive. Okay. Atypical pneumonias including COVID-19 often present with the dry cough. Bronchiectasis, productive changes in posture including sputum production. Pulmonary edema, you'll see often at night, may be productive of pink frothy sputum. Interstitial fibrosis, dry and distressing cough. Drug side effects, angiotensin converting enzyme inhibitors, that is captopril, enalapril. Okay, those you will be seeing dry cough. Okay, and aspiration in GERD, you will see history of acid reflux, heartburn, sciatic hernia, and obesity. Clinical features of the GERD. Okay, in these cases, due to aspiration, there may be cough. Okay, guys, this is for today. We learnt about cough, origin, different cases of different causes of cough and origins, and what are the different types of clinical features the patient will be presenting with in different origin cases. Okay, guys, this is for today. Thank you.